Hi and welcome back to the AQA GCSE History Britain Health and the People revision series. This is episode 7 and we're looking at the changes in medical treatment. Many doctors were reluctant to accept that Galen was wrong. This meant that they continued to use similar techniques as in the Middle Ages, like bloodletting and purging. Doctors tended to focus more on reading books than treating patients. Doctors were also still very expensive. As a result, most people had to use healers such as apothecaries or barber surgeons, or were treated at home. Herbs were still the main ingredient used in many drugs. In the 1700s, electricity started to be used by some medical treatments. However, it was rarely effective. Superstition and religion were still very important. People thought that the king's touch would cure scrofula, which is a skin disease known as king's evil. Thousands of people with scrofula are thought to have visited King Charles I in the hope to be cured. Some people sold medicine that didn't really work, and often did more harm than good, but it was known as quackery. Quacks sold their wares at fairs and markets, and often had no medical knowledge. From 1600, the College of Physicians started to license doctors to attempt to stop quackery. The Great Plague struck the town of London in 1665. It was a rare but deadly recurrence of the medieval Black Death. The response to the Great Plague were both similar and different to how people reacted to the Black Death. For similarities, many treatments for the Great Plague were based on magic, religion, and superstition, including wearing lucky charms or amulets, saying prayers and fasting. Bloodletting was still used, even though this probably made the plague worse. It created wounds which could become infected. Some people also thought that miasma caused the disease, so they carried around posies of herbs or flowers to improve the air. For differences, towns and parish councils tried to prevent the disease spreading. Plague victims were quarantined to stop them passing on a disease. The victims' houses were locked and red crosses were painted on their doors. Areas where people crowded together, such as theatres, were closed, and dead bodies of plague victims were buried in mass graves far away from houses. The responses to the plague came from local councils. They did more to try and combat the Great Plague than they had done before with the Black Death 300 years previously. But there were no national government attempts to help the prevention. The plague gradually began to disappear. Many think that the Great Fire of London of 1666 helped wipe it out by effectively sterilising large parts of London. It burned down old, crowded houses, killing plague bacteria. So that's the end of episode 7 of the AQA GCSE History Britain Health and the People revision series. Next episode we'll be looking at the rise of doctors and surgery. Thank you for watching and I hope you enjoyed.